Well, hello again, everybody, and welcome back into the Keep Boone Healthy Community Information Channel. I am David Jackson from the Boone Area Chamber of Commerce, joined today by Chuck Mantooth, President and CEO of Appalachian Regional Healthcare System. The hospital system with some big news earlier this week, announcing a new partnership with UNC Health. And we want to hear a little bit more about what all is in store for that partnership and just how that will impact healthcare here in the high country. So Chuck, gracious enough to join us here today. Thank you for spending this time with us and helping us get the facts out about what is a very important transaction for Appalachian Regional Healthcare System.
Great. Thank you so much, David. I always truly appreciate the time spending with you, and I appreciate what you guys are doing on behalf of the business community. So, yeah, we had a great announcement this week. On Tuesday, we announced our strategic partnership or affiliation with UNC Health, which is obviously that's a brand that goes pretty easy to recognize around the state and even in this area of our state, Western North Carolina. So pretty excited about that. I was just commenting on some Carolina blue skies out there. So I guess that was a little bit of a gift too, but it's been a great process that the board has gone through over the past year. A little bit of a story there that we started that process about July of last year when we saw ourselves, it felt like that we were moving towards the latter part of the pandemic. That was a disruptive time, and the board took on some long-term strategic planning and really looked at critically at our organization and looked at what we felt like the community was going to look like over the next 5 and 10 years. And then started filling in, we want to do the best that we can for the community. So how do can we do some of those things on our own, and do we need a little bit of help? And if so, what areas do we need some help in? So that process concluded, I would say around the fall. And then we started actively talking about some conversations with other healthcare systems. And obviously we announced back in February that we had moved along quite a ways in that process. And we're actively talking to just a few healthcare systems that we really felt like there was a strong possibility that we would have a relationship with. And that concluded last Thursday night. The board took a vote. It was unanimous that we moved forward with a management agreement with UNC Health. And from that point on, it's been a communications process, but it's been fun working closer with the UNC Health folks. And we're pretty excited about what the future holds.
So I think one of the popular questions about all of this is what management agreement means. And I think maybe to take it a step further, did the healthcare system get sold? And we'll let you address that.
Yeah. So, just like a really good golf ball, you teed that up perfectly. Let me start with what it's not. And that's probably the best place to start to answer that question. We're not being sold. We're not merging. There's no acquisition of assets. There's no change in leadership. That's all the way from the governance to our current executive structure. So what this purely means is that we'll have a really well-recognized partner in the state to help us manage the organization. And what that means is we'll have access to a lot of the resources that they've built up over time, whether that's academic resources, technology, resources from a workforce standpoint. There's just a lot of opportunities under that UNC Health umbrella that now we'll have access to. And most people may not know that our structure is we're a 501c3 not-for-profit organization. And what that truly means is that there's a board of 15 trustees that are responsible. They're fiscally responsible. They're responsible for the quality, the providers. All of that falls up under our 15-member board. And that board governance structure is not changing, but their responsibility is they're handing off part of that responsibility for management to UNC Health. And we really feel like we've got a good partner to move us forward. So those are some easy questions to answer what it's not.
Okay, so I'll ask another one then too. Another popular element of this really refers to the local nature that we have enjoyed about our healthcare providers and systems and practices here for quite some time. Is there anything about any of those dynamics that will change from a staffing perspective, how you acquire staff and are able to retain staff, but then also within the practices too? Does that mean that maybe this will open up access to new pathways to physicians and some of those things that maybe people see this as an opportunity to maybe reimagine?
Yeah, it'll change for the better. And let me explain a little bit of that. If folks in the community are seeing a doctor, they'll continue to see that doctor. They'll continue to see the bright, smiling faces when they walk in the office that they're used to. None of that's going to change. What will change, though, and this is kind of one of our probably top criteria, is we wanted to align ourselves with an organization that had a very mature, robust EHR, electronic health record. And that's what we felt like is best in the industry is a software called Epic. And as a matter of fact, Epic, pretty much 90% of the state of North Carolina has an Epic chart somewhere. It's what all the big systems use. It's very developed. UNC Health has invested millions and millions of dollars in the architecture to make sure that Epic system works well together with the providers, with the community. So that giving our providers those tools will allow them, those same providers that folks are used to seeing, will give them a more efficient process to work with colleagues, communicate directly with our patients. It'll just give them a lot more tools than what they're used to. So, but that relationship with their current provider will not change.
So one of the other elements to this, I think, that's important from that records keeping perspective, I'm sure that there are all kinds of back end efficiencies that your team and your physicians, nurses, whoever will enjoy from the administration end of healthcare. But take that around to the front end a little bit. Me as a patient, what does that mean for me in terms of opening up some new opportunities through technology to have just a little bit better conduit directly to my providers and being able to take some of my own healthcare administration, if you will, into my own hands?
You know, one of the things, David, that we feel like is going to be really, really important in the future is for patients to have an active role in their healthcare. And what that means, that could start all the way from health literacy to understanding, health terminology, just what's going on with their own, and have a meaningful conversation with their provider, their doctor. And when you have those two things, it usually results in a really good, healthy outcome. So that's a great place. And the interaction can get in the way sometimes due to technology. It's just like this connection. We had a little issue before. When that's not working well, you usually don't get a good outcome. But when it's working really, really well, that just enhances that relationship that the patient has with that provider. So what we will get is what's called My Chart. And that's a portal that you can ask questions to your doctor, get prescription refills, schedule appointments, pay bills, those things right now that get in the way of us having, just a top-notch reputation. I feel like we provide really good care. But I feel like that one of the areas that we fall short is our technology, and that can get in the way as far as scheduling appointments and things like that are very frustrating to patients currently. And, eventually it could turn into a problem where they just don't get the prescription filled or they don't schedule an appointment because of that interaction. So we want to make that as easy as possible. And that's really what we'll be gaining is that technology piece. And we really felt like that's what the future looks like.
Chuck, I know that you and your system have been so helpful in aligning insurance relationships with the top providers that really, I'll call it, service the vast majority of our community. Because of this management relationship with UNC Health, do you see any of those relationships changing, or will people still be able to get, for the most part, that same relationship between the insurance provider they have and the physician that they're able to see?
Yeah, that won't change. The current agreements we have in place with a whole host of insurance companies, the top ones being Blue Cross Blue Shield of North Carolina, United Healthcare, there's a whole Medicaid, Medicare, all of those won't change. And that's really due to where we started, that corporate structure. None of that's changing. So all those contracts will remain in place. So folks shouldn't have anything to worry about being out of network. We have a strong belief that we want to try to make that an easy process for the folks that want to use our services, and we'll contract with most anyone that we can.
So I guess the last of the major questions here, Chuck, and appreciate again your transparency and your facts on all of this, so we can get some of these helpful bits of information out there for people to understand really what this agreement is, and as you said earlier, what it's not. From a time frame perspective, how soon do you anticipate seeing some of these things implemented, and when will patients be able to recognize some sort of change, especially on the electronic side? Some of the things you were just talking about, being able to schedule appointments, refill prescriptions, things like that.
Yeah. So real quick, I mean, this is a top-notch organization. As soon as we sign the agreement, it doesn't go into effect until July 1st of this year, which is just a little bit less than 2 months from now. But they've committed, said, look, we want to get a head start on the agreement. So I've already had multiple phone calls this week on just high-level planning things that we can really accelerate our results. But internally, our providers and staff will have immediate access to some resources they didn't have. And we'll probably start seeing some, results of that over time. But the real work begins in January, and that January is our training and our building process to go on to UNC Health's IT platform. And then patients really will start seeing the benefit in October of next year. That's a lengthy process just because of the complexity. But October of next year, which is about a year after we're going to open this new building, the patients will really start seeing the benefits from that.
Yeah, my final two questions for you are a little bit about, just kind of the overall brand that you've created here. First one is an easy one. Will the name of the system as we know it today as Appalachian Regional Healthcare System, will that undergo any changes?
It won't. Well, actually, technically it will. If UNC Health is matter of fact, I want to say it's in the top 4 most recognized brands as far as trust in the healthcare system across the country. So that's what we're becoming a part of. And we want to emphasize that. It's not something that we want to hide, but also we want to combine that with what the brand that we've already built over the years that we're pretty proud of. So, what you'll likely see is Appalachian Regional Healthcare System, and then, an affiliate of UNC Health. And that will slowly become more prominent in the community as we change signs and things like that. So we're pretty excited to share that branding platform with such a prestigious organization.
Well, and then the last thing that I would ask along the lines of that branding, and certainly when you're looking for partnerships, those partnerships have to go both ways. With the investment that you've made here in facilities recently, and the campaign that you've got in trying to finish off the current facility projects that you have in a top-notch manner, did that make this more attractive from UNC Health's perspective, to know that they were not necessarily partnering with a system that had a lot of work to do, that they're really getting a great return on their investment in this as well, and that's quality healthcare delivery here in a very important region of the state?
It's hard to talk about yourself, but from when I'm talking about the organization, and I told our leadership and I told our employees that, they should be very, very proud of what they've built. And this is not me. This is them that has the interaction with the patients and treat. The reputation, along with that brand we talked about, is really due to the care that they provide. So because of that, because Boone is such a beautiful area, the attraction with Appalachian State University, which is in the same university system as UNC, all of those things really, really made us a very attractive organization. So I feel like that put us in a really good position to have good, meaningful conversations about what the future looks like and what we could obtain by working with UNC Health.
Well, Chuck, I again appreciate your willingness to come on and share some of these intricacies with us. I think, especially in a community like ours, and communities really like ours all over the country, when you see change, especially with a trusted partner, it's natural to be a little bit skeptical, but also credit to you and your team for getting this information out in a timely fashion and help people absorb the positives of a relationship like this. And I think we'll all be able to realize those for many years to come. So appreciate your leadership on this and your willingness to share. And we look forward to talking to you again soon as you get that new building just about ready to open. It looks beautiful from the outside. I'm sure it's getting to the point where it's just about as finished on the interior, right?
It's getting very, very close. I can't be more excited. And we're looking at an October move-in, so that's a great thing for the community. The next 15 months are going to be some real wins for the community with new building and new systems to work with. So pretty excited about that.
Absolutely. Well, Chuck, thank you again for your time, and best of luck to you and the rest of the crew at Appalachian Regional Healthcare System. We thank you for everything that you do here in our community, keeping us healthy. Look forward to talking to you again soon.
Thank you, David.